Put everything down for a moment. Whatever you are doing right now, I need you to stop because what Dr. Thomas Semeth is about to share with you in the next few minutes could genuinely be the most important thing you hear all year. If you or someone you love wakes up with feet that feel like blocks of ice, if your legs ache and feel heavy by mid-afternoon, if your ankles swell like balloons by evening, or if you have simply accepted that your circulation is just declining the way everything else seems to decline after a certain age, then this video was made specifically for you. My name is Dr. Thomas Semeth, and I have spent more than 22 years working at the intersection of vascular medicine and nutritional biochemistry. I have treated hundreds of seniors with compromised leg circulation, and I am here to tell you something that the standard 10-minute doctor's appointment almost never has time to cover. There is one specific vitamin, not magnesium, not the one every other health video keeps pushing, that the research now identifies as the single most powerful nutritional intervention for restoring leg circulation in adults over 60. And when I tell you what it is, I am willing to bet it is not what you expect. But before we get there, Dr. Thomas Semeth wants to give you a number that genuinely stopped him in his tracks the first time he encountered it. A comprehensive population study tracking adults over the age of 65 found that approximately 1 in 3 people in that age group already has measurable compromise in the blood flow supplying their lower extremities. 1 in 3. And the vast majority of those individuals had no clinical diagnosis. They were not in a hospital. They were sitting in their living rooms telling themselves that the burning in their calves was just normal aging, that the cold in their feet was just sensitivity, that the nighttime leg cramps were something they simply had to live with. They were not right. And this video is going to explain why, and far more importantly, what you can do about it starting today. Dr. Thomas Semeth is going to count down from 5 to 1. With 5 being highly effective and 1 being the most evidence-supported vitamin for aging leg circulation that modern research has identified. He is going to stay with you all the way through because the synergy tip at the very end, the combination that multiplies all of these individual effects dramatically, is something almost nobody in the mainstream health space is talking about. Do not skip ahead. The order matters. And before we go further, Dr. Thomas Semeth wants to hear from you directly. Drop a comment right now and tell him 2 things. First, your age range, whether you are in your 60s, 70s, 80s, or beyond. And second, where in your body you feel the circulation struggle most. Is it your feet, your calves? Do you wake at night with cramping? Do your ankles look different at 6 in the evening than they did at 8 in the morning? Every comment is read. Your experience shapes the content on this channel. Take 5 seconds and share it now. Let us begin. Coming in at number 5 is a vitamin that already surprises most people when they see it on this list. Vitamin B3, niacin, specifically in its extended release form. Here is what most people fundamentally misunderstand about what aging does to your blood vessels. After 65, the inner membrane lining every artery and vein in your body, a tissue so thin and so precise that scientists call it the endothelium, begins to lose its functional capacity. Think of the endothelium as the intelligent skin on the inside of your pipes. In a young, healthy vascular system, this layer constantly monitors blood flow, releases chemical signals to widen or narrow vessels as needed, and maintains the kind of smooth, flexible environment that allows blood to move freely. Coming in at number 4 is vitamin K2, and specifically the form labeled MK7. Dr. Thomas Semeth knows that when most people hear vitamin K, they think blood clotting. That association is with vitamin K1. Vitamin K2, particularly the long-acting MK7 form, has an entirely different and far less understood role in the body, one that is critically relevant to anyone concerned about circulation in their legs. Its primary job is what Dr. Thomas Semeth calls calcium traffic control. Here is how he explains it to patients. In a young, well-nourished body, calcium behaves like a perfectly trained delivery driver. It goes exactly where it is supposed to go, straight to your bones and teeth. But in an aging body with depleted K2, that driver loses his GPS. He starts dropping calcium deliveries in the wrong locations, primarily inside the walls of your arteries. This process, arterial calcification, is one of the most significant and most underappreciated drivers of poor leg circulation in people over 65. Research from one of Europe's leading cardiovascular nutrition centers followed nearly 5,000 adults over multiple years and found that those with the highest K2 intake had more than 50% lower rates of arterial calcification compared to those with the lowest intake. Among individuals who already had early calcification in the peripheral arteries supplying their legs, K2 supplementation meaningfully slowed the progression within 18 months. The mechanism involves a protein called matrix GLA protein, which functions like a biological anti-calcification shield on your arterial walls. This protein requires K2 to be activated. Without it, the shield goes down and calcium deposits freely. With adequate K2, the shield goes back up and your arteries regain their ability to stay clear, flexible, and capable of carrying blood all the way to your feet. Look for MK7 specifically, not MK4, which clears too quickly to maintain stable vascular levels. Take 100 to 200 micrograms daily with a fat-containing meal because K2 is fat-soluble and requires dietary fat for meaningful absorption. The synergy tip is D3 and K2 together. D3 drives calcium absorption from the gut, and K2 ensures that calcium reaches bone rather than arterial walls. This combination is one of the most well-validated duos in senior cardiovascular nutrition. Number 3 is where things become genuinely exciting and where Dr. Thomas Semeth has personally witnessed some of the most dramatic patient transformations in his career. Number 3 is vitamin E, but not the version you will find on most pharmacy shelves. We are talking about tocotrienols, the biologically potent members of the vitamin E family that the mainstream supplement industry has almost entirely overlooked. Here is a fact that Dr. Thomas Semeth finds both scientifically fascinating and deeply frustrating. The most common form of vitamin E sold commercially is a synthetic version that research has shown can actively compete with and suppress the absorption of the more therapeutically powerful forms of vitamin E in your body. You could be taking a vitamin E supplement every single day and simultaneously blocking your access to the very compound your vascular system needs most. That is not a scare tactic. That is documented biochemistry. Tocotrienols, particularly the delta and gamma forms derived from natural plant sources, have been studied extensively for their effects on peripheral vascular health in older adults. One peer-reviewed study found that tocotrienol supplementation over 12 weeks improved blood flow velocity in the peripheral arteries of adults over 65 by an average of 24%. Even more striking, it reduced arterial stiffness by 18%. Think about what arterial stiffness means in everyday terms. When your arteries lose their elasticity, they cannot expand and contract with each heartbeat the way they are designed to. Blood pressure against stiff walls increases. Flow to distant regions like the feet and calves slows. Tocotrienols work at the membrane level of your arterial walls, neutralizing the oxidative damage that makes vessels rigid in the first place. Their antioxidant potency has been measured at many times greater than standard alpha tocopherol in human tissue studies. Look specifically for tocotrienol products derived from annatto, which provide the active fraction without the competing synthetic forms. A daily dose of 150 to 300 milligrams taken with your fattiest meal of the day is within the clinically studied range. The synergy tip here is omega-3 fatty acids. Research indicates that DHA from fish oil and tocotrienols together reduce inflammatory signals in arterial tissue in a way that is genuinely multiplicative rather than simply additive. And now we reach the top 2. Number 2 is a vitamin most of you have heard of, but the version you have been told about and the dose you have been recommended are almost certainly not the version and dose the research says your aging vascular system actually needs. Number 2 is vitamin D3. And here is the truth your last blood test result may have hidden from you. Most physicians define vitamin D sufficiency at 20 nanograms per milliliter. That threshold was established to prevent bone disease. But research from major academic medical centers has demonstrated that optimal vascular function in seniors, meaning arteries that can actually dilate on demand and deliver blood efficiently to your legs, requires blood levels between 50 and 80 nanograms per milliliter. The difference between not deficient and vascularly optimal is enormous, and the majority of seniors are sitting somewhere in the 20s and 30s, believing their vitamin D is fine, while their leg circulation silently deteriorates. Here is the mechanism. Every blood vessel wall in your body contains specific receptor sites that respond exclusively to vitamin D3. When D3 binds to these receptors, it triggers the local release of nitric oxide. Nitric oxide is the molecule that tells your arteries to relax and open wide, allowing blood to flow with less resistance and greater volume. Without sufficient D3, these receptors go quiet. Your arteries stay narrower. Your legs work harder for less blood. A large meta-analysis pooling results from nearly 24 randomized controlled trials and more than 20,000 participants found that D3 supplementation meaningfully improved endothelial function in adults over 60, with the most pronounced effects in those who began with lower baseline levels. Dr. Thomas Semeth wants to share a patient story here. A man he will call Gerald, 79 years old, came to see him after 2 hip surgeries had left him with persistent coldness and numbness in both feet. His surgeons attributed it to post-operative nerve sensitivity. His D3 level was 21 nanograms per milliliter. Dr. Thomas Semeth placed him on 5,000 IU of D3 daily, alongside K2 and targeted B vitamins. At his 12-week follow-up, Gerald's D3 level had reached 64. The ankle brachial index, a clinical measure of lower limb circulation, had improved by 26 points. His physical therapist, who did not know about the protocol change, noted unprompted that his tissue perfusion seemed dramatically improved. Gerald told Dr. Thomas Semeth the numbness had almost entirely resolved. That is not coincidence. That is vascular physiology responding to the correct nutritional environment. Always take D3 as cholecalciferol, not D2. Take it with your fattiest meal, always alongside K2, and get tested. Ask your physician specifically for a 25-hydroxy vitamin D blood test and aim for that 50 to 80 range. After 70, skin synthesis of vitamin D from sunlight drops by more than 70% compared to younger adults. Supplementation is not a lifestyle preference for most seniors. It is a physiological necessity. And now we arrive at number 1, the vitamin that Dr. Thomas Semeth has been building toward, the one that is not magnesium, not D3, not any of the others covered tonight. The one that sits at the very top of the evidence hierarchy for peripheral vascular health in adults over 60. Are you ready? Number 1 is vitamin B9, folate, and specifically its biologically active form known as 5-MTHF, or L-methylfolate. Yes, folate. The same nutrient associated with prenatal health. And the reason it tops this list for senior leg circulation is grounded in some of the most compelling cardiovascular research of the last 3 decades. Here is the science, and Dr. Thomas Semeth wants you to follow this carefully because it changes how you see your own body. In aging adults, particularly after 70, a compound called homocysteine accumulates in the bloodstream. Homocysteine is a natural byproduct of normal cellular metabolism. In low concentrations, it is harmless, but when it builds up, it is directly corrosive to the endothelium. Research published in one of medicine's most prestigious journals found that for every 5-unit rise in homocysteine above the optimal threshold, the risk of peripheral arterial disease, the condition that compromises blood flow to your legs, increases by 60%. And the average senior over 70 has homocysteine levels that exceed that optimal threshold significantly. Folate, specifically in the active 5-MTHF form, is the primary driver of the metabolic pathway that clears homocysteine from your blood. Think of homocysteine as rust accumulating inside your arterial pipes. Folate is the chemical agent that dissolves it. Without adequate folate, rust builds. Vessel walls inflame. Blood flow to your legs slows month by month, year by year. A gold standard randomized controlled trial from one of the world's leading nutrition research institutions found that folate supplementation significantly slowed the age-related progression of arterial stiffness over a 3-year period compared to placebo. And when researchers shifted to the active 5-MTHF form rather than synthetic folic acid, results were even stronger, particularly in the large percentage of older adults who carry a genetic variation that prevents them from converting synthetic folic acid into the usable form their bodies need. These individuals can take standard folic acid every day and receive almost no circulatory benefit because the conversion simply cannot happen. Give them 5-MTHF and their bodies use it immediately, directly, without any conversion step required. A clinical study focusing specifically on adults over 65 found that supplementation with 5-MTHF at 400 to 800 micrograms per day reduced plasma homocysteine by 34% within 12 weeks, accompanied by measurable improvement in how effectively the brachial artery dilated in response to increased blood flow demand. In plain language, their vessels became dramatically more responsive and capable of delivering the blood their legs needed. Look for L-methylfolate or 5-MTHF on any supplement label. Take 400 to 800 micrograms per day in the morning. Unlike the fat-soluble vitamins covered earlier, folate is water-soluble and does not require food for absorption. Now, the synergy tip Dr. Thomas Semeth promised at the very beginning of this video. Pair your 5-MTHF with two specific partners, methylcobalamin, which is the active neurological form of vitamin B12, and pyridoxal 5-phosphate, which is the active form of vitamin B6. Here is why this trio is so powerful. Folate, B12, and B6 all operate within the same homocysteine-clearing metabolic pathway. They are enzymatic partners. Folate without B12 is like a surgeon with no scalpel. B12 without folate is the scalpel with no surgeon. You need all three present and active simultaneously for the pathway to run at full efficiency. B12 deficiency in seniors is alarmingly common because the same decline in stomach acid that impairs folate absorption also reduces the production of intrinsic factor, the protein required to absorb B12 from food. Research estimates that up to 40% of adults over 60 have suboptimal B12 status. A study examining this specific three-vitamin combination in seniors with documented peripheral arterial disease found that the triad reduced homocysteine levels by an average of 38% and improved pain-free walking distance by over 40% within 6 months. 40% improvement in how far they could walk before their legs forced them to stop. Think about what that number means in terms of a life actually lived. Dr. Thomas Semeth wants to leave you with something that goes beyond biochemistry tonight. Your circulation is not just a medical statistic, it is your freedom. It is whether you walk your grandchild to school or watch from a window, whether you stroll through a market on a Saturday morning or sit on a bench because your legs will not carry you further, whether you feel like yourself or like a diminished version of the person you have always been. The science covered in this video is not speculative, it is not fringe. It is published in peer-reviewed journals, validated in randomized trials, and confirmed in the offices of physicians who take nutritional medicine seriously. Your endothelium can respond, your homocysteine can clear, your arterial walls can regain flexibility. It is not too late. Dr. Thomas Semeth has watched it happen in patients in their 80s who had given up entirely, and he wants you to take this information, talk to your physician, and give your legs the nutritional environment they have been waiting for. If this video has given you something real tonight, a framework, a new conversation to have with your doctor, a reason to feel genuinely hopeful about your mobility and independence, please do two things right now. Hit the like button, because it tells the platform that this kind of deeply researched content deserves to reach every senior who needs it. And subscribe to this channel where Dr. Thomas Semeth publishes evidence-based content on vascular health, metabolic function, and longevity for adults over 60 every single week. This community is growing because the information here is real, the research is sound, and the results speak for themselves. Share this video with someone you care about. Because there is someone in your life right now who is accepting leg pain and cold feet as their permanent reality, and they do not have to. Your legs carry you through life. It is time to carry them.